Okay, everyone, good morning, good afternoon, good evening again. Thank you to those of you joining already. We're going to get started now in the interest of time. And welcome to those as well watching the recording later on. We're very pleased to welcome you to our second WashFit meetup of this series in 2026. Today's session is going to be all about healthcare waste management. Just to provide a quick overview of these sessions, this is the second of the meetups. The first one was in February, which was all about water quality management. If you missed that session, please do check out the recording on our YouTube channel. There's a QR code for you to scan to watch that directly. And the slides of that session, as well as the slides of today's session, will be on the WASH in Healthcare Facilities knowledge portal. That's washinhcf.org. The purpose of these meetups is to have an informal opportunity for practitioners, for people working in this space, to get together, to learn about a specific technical area related to WashFit, to hear from some countries on their experience of using the tool and how they're making improvements locally and nationally, and also to have a space to ask questions. So some of you have already submitted questions in advance when you registered, and we'll do our best to try and answer some of those questions. If you weren't able to submit questions in advance, please do so now in the Q&A area of this webinar, and we'll be pleased to answer them throughout this session. Today's agenda, we will have our technical presentation from our experts, Ute Piper and Maggie Montgomery from WHO, looking at what some of the new guidance is in safe and sustainable healthcare waste management. We've got an excellent country presentation from our colleague from Fiji Ministry of Health and Medical Services. Plenty of time for questions and answers. And then our colleague Dave Truber from WHO is going to give you a short sneak preview of a new and upcoming course on the WHO Academy all about waste management. So without further ado, I will pass over to our excellent moderator, my colleague Ranjit from UNICEF. So over to you, Ranjit.
Thanks, Arabella, and welcome colleagues to this very interesting session on waste management. As a part of WashFit series, I'm very happy that the second session is on waste management. WASH and health, we go hand in hand in sort of, when we look at the health facility, we look at primary healthcare and we look at healthcare waste management from the primary healthcare perspective. We want to break the silos of waste management. For immunization waste management, for HIV, it's primary healthcare waste. And with that perspective, it's very important to have the key messages right when we deal with the subject. What is infectious? What is not infectious? How do we deal with infectious? How do we deal with non-infectious? Who are we here to protect at the at the health center? Our health workers, people visiting. How do we protect it? What are the technologies we use to manage the infectious waste, etc. So we have Ute. Won't delay. I'll pass on to Ute. We'll talk about safe and sustainable healthcare waste management practices and what's new. Ute, over to you.
Thank you so much, Ranjit. Good morning from Berlin. I just would like to present a brief presentation on healthcare waste management, just to set you into the scene, together with my colleague Maggie Montgomery, who will do the interlink to WASH and WashFit later on. We will start with some background information about the environmental and human health impacts of healthcare waste management, just to remind you. So when we talk about healthcare waste management, most of the waste which is generated is general non-hazardous waste. This is something which is sometimes really forgotten, and only 15% is considered as hazardous, of which 10% is infectious, sharp waste, pathological waste, so potential infectious waste, and the other 5% is pharmaceutical, chemical, and radioactive waste. These are just estimations from WHO, of course. So each and every country and each and every facility will have different proportions of this waste. So therefore, we are really also encouraging to do weighing at the source of the generations. So why is this waste which is generated or might be dangerous for the environment and the health? So first of all, you can see here the landfill. So a lot of this waste is getting on not proper controlled landfills, but on dump sites which are not secured, so that the leaches can went through the soil into the water, and also the emissions from the landfills, which is producing methane and carbon dioxide, which are greenhouse gases, which can really trap the heat in the atmosphere over a 100-year period. So we are not just talking about today and tomorrow. So it's really something we need to think of also for our future and our children later on. Another emission which might occur from healthcare waste management is the emissions from the incineration. So what can be generated by incineration are dioxin and furans. So again here, the furans and dioxin can settle in the soil and water bodies. They can affect wildlife and the ecosystems. They persist, like also the methane, in the environment for decades and accumulate in fatty tissues of animals and moving up to the food chain, up to ourselves, so that we can really accumulate dioxin and furans in our bodies. So this is just, why are we talking about healthcare waste management when we look at the environmental part? WHO has issued a bunch of guidances in this area. Most of them you probably will know. The most comprehensive one is from 2014, the second edition of the Safe Management of Waste from Healthcare Settings. So this is really a comprehensive guidance on waste management, which is tackling everything from classification, risks, planning, disposal, treatment, everything you can think of is there. So there's also a short summary of this document. And there's a quite new one, which has been launched last year. It's about pharmaceutical waste. So I will talk about this a bit later again. There's one about treatment technologies. So this is from WHO, but there's also one from UNICEF, which is more focused on alternative treatment technologies. Then we have the open access WHO academic courses. So the WashFit course, in which also one module is healthcare waste management. And then we will have an advanced healthcare waste course, which will be launched in June. Dave will talk about this later on, so I will not go into detail here to let him the floor here. Then we have the training tools, the WashFit tool, which is, I think, a very comprehensive tool. And one of these modules is also healthcare waste management. Maggie will talk about this later as well. So I will just go quickly through the different steps, and I really would like to focus more on the practical issues in the healthcare settings, not talking about national strategies. So what are we're talking about? So first of all, the segregation. The segregation is really the heart, the key of healthcare waste management. When the segregation is done not properly, so when you mix the waste, all the other steps will be influenced and cannot be done in a safe and environmental friendly way. In general, we have in most facilities, we have a 3-bin system. We have general waste, we have infectious waste, and we have sharp waste. So these 3 bins we will find in, I think, all facilities. Doesn't matter which level, if we have a health center or a tertiary hospital. And then we can have additional waste classes depending on the waste generated. But these 3-bin system is like the standard and the heart of everything. So what are some practical solutions and technologies we should look at? So at the moment, we are really focusing a lot on waste prevention and the reduction of hazardous waste generation as a first step. So I think I really would like to encourage you also just not only to think about hazardous waste treatment, about incineration, but really to think of how can I reduce the waste? How can I introduce recycling? So there are a lot of small pieces we can just put together to have a more green hospital or health facility at the end. So think of how and what to procure. So don't use personal protective equipment if it is not needed. Use bio-based packaging and PPE materials. You can use reusable water jugs instead of 1 liter water bottles, for example. Purchase mercury-free and PVC-free products. Introduce recycling. So in a lot of countries, at least for cardboard and paper and bottles, recycling possibilities are there. Maybe not formal, but informal, but there might be something which is also near to your health facility so that you can start there. Start with composting of biodegradable waste. Start when you have a garden, you can start composting. You don't need to put this on your waste heap, or you don't have to burn it, right? So you can compost that. Shred or compact plastic or cans, crush vials to reduce the volume and prevent reuse. So these are just some examples which could be done without a lot of financial resources as well. Furthermore, what is also some recommendations which you could consider for the storage of infectious waste, to extend the storage times by using refrigerators or freezers for infectious waste or for pathological waste, for placentas, for example. The storage times of infectious waste is in a lot of settings a problem, because to get the waste treated or collected every 2 days is often an issue, and to cool down the waste is one possibility to extend the storage times. Implement solar systems for reliable electricity, also for the freezers, for waste treatment technologies like autoclaves or microwaves, for example, and provide safe waste storage infrastructure. So these pictures are quite sophisticated, but talking about waste storage, also like simple infrastructure which is ensuring that the waste cannot be accessed by unauthorized persons or animals, is already a big step forward. Yeah. The external transport of waste, especially for smaller facilities, this is often a problem, because the smaller facilities often do not have proper waste treatment or disposal technologies. So one possibility is to use reverse logistics. So when the medical devices or products are transported to these facilities, this transport vehicle can also transport sharp waste, for example, and infectious waste back to a central hub where the waste could be treated. So this system, these vehicles are already available. So we just need to have some additional precautions on this reverse logistic system, like to train the drivers, to have proper packaging for the transport, etc. Treatment technologies, WHO, but also UNICEF is recommending to use alternative treatment technologies to treat infectious and sharp waste where possible. However, all the technologies should be in accordance with the Stockholm Convention requirements, and these are jumping in when we talk about incineration. So here we need high temperature two-chamber incinerators with additional flue gas treatment systems. So these incinerators, in accordance to the Stockholm Convention, like you can see here on the right corner, need flue gas treatment, and this is not readily or complete available for smaller facilities. So for incineration, this is mainly for centralized facilities. So this is a an example from Ghana of a centralized autoclave, which is used for the for the Greater Accra region in Ghana. So it serves about 4 million inhabitants. I will not go into details, but these centralized, it's a private facility, this private facility is paid by the health facilities, and at the end by the Ministry of Health. So the budget, of course, is a crucial point here. In general, we need to move away from open burning. So this is like something we need step by step, like an incremental improvement. We need to step away from open burning. Maybe we cannot solve the problem this year, but we need to plan on solving the problem, to have proper treatment technologies and to have proper disposal facilities. So one of the new guidances we have is the guidance on safe management of pharmaceutical waste from healthcare facilities and global best practices. So that we also have a bunch of examples and case studies in this document. It is focusing on pharmaceutical waste in emergency, but also the standard procedures for pharmaceutical waste in non-emergency situations. We are emphasizing on the prevention again, on minimization, but also we are proposing optimal solution and interim treatment solutions. So when we talk about, we are already there. Okay, so now I would like to hand over to Maggie Montgomery to introduce or interlink waste with the WashFit tool. Thank you.
Super. Thank you, Ute. And yes, I just wanted to take a minute or two to talk about how WashFit, and hopefully all of you are familiar with the tool, which is the incremental improvement tool, can be used to help improve not only the waste practices, but the waste infrastructure. So WashFit, it starts with doing an assessment, and there's a detailed guide on the assessment for healthcare waste, which includes both basic indicators, advanced indicators. It also signifies some of those important elements that Ute mentioned around waste reduction, around sustainable waste, about reducing the carbon footprint. Next slide. Last year, WHO and UNICEF conducted a global evaluation of the use of WashFit, and there were some really interesting findings. First of all, it's in use in over 70 countries now, so it's really exciting to see how that tool is being adapted and implemented at the national level. One thing that we found that makes the use of the tool more effective is when it's directly linked to standards. And what's interesting on the waste side, according to the country tracker, which WHO and UNICEF published last year around the national actions to improve wash and waste in healthcare facilities, improved and advanced waste standards is one area where countries have made the most progress. So linking the implementation efforts to strengthen standards that look at things like mercury and pharmaceutical waste and waste reduction are super important. You can see it's a little bit hard to see the graph. I encourage you to go online and actually download the document, but you can see that improved waste services, countries reported over 90% of facilities demonstrating improved waste services through the use of WashFit. Next slide. And just to give one specific example of WashFit in Ukraine, which is a country that I've worked in most recently around the use of the WashFit, we found that when the training with WashFit was coupled with some small amounts of seed funding and pilot facilities with engagement with the subnational authorities around the regulation and monitoring of waste, that we found impressive improvements. Actually, waste and hand hygiene were the two areas that improved the most through the use of WashFit. We also found that facilities that were able to engage the local authorities and go beyond just their own facility made even more improvements because they were able to leverage funding. They were able to leverage, in the case of waste, engagement with private sector, who in many countries is the sector that takes the waste after it's been segregated and properly stored in the facility. again, encourage you to take a look at this paper, which is in the WHO Bulletin if you have more questions. So with that, I'm going to now pass it back to Arabella or Ranjit. I think it's Ranjit, sorry, to continue today's discussion. Thank you.
Thanks, both of you, Maggie and Ote. Very useful. Interest of time, I invite Luke Wono-Tabua from Fiji sharing the experiences.
Thank you. Thank you, Ranjit. And it's 7:30 p.m. in Fiji. And good evening to you all. And thank you for the opportunity to present on the use of WashFit to support safe management of healthcare waste in Fiji. So a presentation overview today, I'll be presenting a bit on the Fiji health system context, the background and importance of healthcare waste, what is WashFit, how WashFit was implemented in Fiji, and the key findings on the healthcare waste management, the challenges identified, how WashFit supports the improvement planning, and also the priority actions for Fiji, and the recent progress and the next step. So for Fiji health system, we are about 930,000 in terms of the population. We are the small island development states comprising of around 330 islands. Administration of the division in terms of the health facilities, there is 4 divisions. We have large rural, remote, and also maritime population that creates unique service delivery and also waste management, healthcare waste management challenges. The Fiji health system network, we have around 3 divisional and specialist hospitals. We have around more than 20 subdivisional hospitals, more than 80 health centers, and around 99 nursing stations. So a total of around 202 healthcare facilities. The implication on for healthcare waste management, all health facilities generate varying volumes of and types of healthcare waste depending on the type of facility. Waste system includes infectious waste, sharps, pharmaceutical waste, and also general waste. The remote and the maritime facilities face additional challenges related to waste collection, transportation, the storage, segregation, transport in the treatment infrastructure, limited workforce, and maintenance supported also the supply chain for PPE, waste management material. Why safe health care facility matters? Because we need to protect our patients, people that are working in our facilities, our healthcare workers, the cleaners, waste handlers, and also the communities and also the visitors that visit the facility. And also it is important because you want to reduce infection risk and also environment contamination, the exposures to the infectious agents and also the chemicals that is containing in the healthcare waste, and also support infection prevention and also the IPC system. Sorry, there's something wrong.
Are you on a wrong slide, Luke? Do you want to move before or after? We can see the slides and see you as well.
Sorry, can you hear me?
Yes, we can.
Hello?
We can hear you.
Can you hear me, Ranjit? Okay. Thank you. Sorry for that. Ensures compliance with national and global health standards, and also strengthen climate resilient and also safe service delivery for our health facility. In terms of the policy foundation for healthcare waste management in Fiji, we have a healthcare waste management policy. We have relevant legislations, and also we are guided by the guideline on climate resilient, environmentally safe healthcare facilities in Fiji. Also, we have done a lot of the trainings to our subdivisions. We train our health facilities and also allow them to develop the health care waste management plan. So they do that. They develop their own healthcare waste management plan and assisted by our officers. What is WashFit? So WashFit is water and sanitation for health facility improvement tool. Developed by WHO and also UNICEF to improve WASH and IPC services in the health facilities. Support continuous quality improvement through a risk-based approach, and also it covers water, sanitation, hygiene, waste management, environment cleaning, clean energy, and also the clean energy and management system. It encourages facility level ownership and monitoring. That is why I've mentioned that we had included our staffs in the development of the healthcare waste management plan, because we wanted them to have the ownership of the plan and also in terms of the implementation of the plan. So the WashFit process in Fiji, national assessment was conducted around 197 health facilities in Fiji. Assessment implemented in 2023 and was completed in the early 2024. There were around 44 staffs that were trained by the Ministry of Health and through the support of the World Health, WHO, and also the UNICEF. Data collected using the digital tool, Kobo tool. The facility teams included IPCOs, IPC nurses, medical officers, cleaners, plumbers, and also the environmental health staffs. And the funding was aligned with the WHO, UNICEF, JNP service leaders. In terms of the healthcare waste management findings for Fiji, it's about 62% of the facilities have achieved the basic service level on healthcare waste management in Fiji. Around 1/3 of the facilities, they lacked proper waste management segregation systems. Nearly half of the facilities did not have secure waste storage areas. Smaller and remote facilities, they face greater infrastructure and also staffing challenges. And the hospitals and health centers generally show stronger performance, while nursing stations face gaps in meeting the basic service requirement. How WashFit supports the safe waste management. WashFit, it helps facilities identify the waste management risk and also the service gap. So when they audit the practice against the plan and then they identify the gaps that is present, they provide structured indicators for segregation, storage, and also transport, and in terms of the disposal of waste. It supports the development of facility improvement plans, strengthen monitoring and accountability through routine assessment. It promotes a multidisciplinary teamwork and staff engagement when developing a healthcare waste management plan. The staffs, they know their responsibility and what they need to do in terms of managing the waste, and supports prioritization of resources and also investment. So you see the key challenges that were identified: limited funding and access to maintenance support, because we don't have a budgetary allocation for healthcare waste management. Inconsistency, availability of waste bin liners and also the PPE. Gaps in the staff training and also supervision because of staff turnover, resignations, weak monitoring system in some facilities, infrastructure limitation in the rural and the maritime facilities, and the need for stronger coordination between facility and divisional level, and the treatment systems. And I think this is one of the areas that we need to strengthen in Fiji in terms of the absence of a treatment system to treat health waste that is generated in our facilities. The summary of the key healthcare waste management indicators by subdivision. In terms of segregation, we can see that most of the subdivisions are doing the segregation. About more than 50% of the facilities are doing the waste segregation. In terms of, sorry, I can move the slide now. Can we move the slide, please? The next slide. Sorry, Ranjit, I can't move the slide now.
I just moved
it's
it.
on. It's now showing
Yes,
the
okay,
graph
so
on
can we move?
segregation.
Right, okay. Thank you. Thank you. So in terms of the waste storage, so you can see as part of the results, there's a good number of the facilities which still lacks waste storage. Is about only 13% of the facilities in Fiji that have waste storage area, proper waste storage area. So that is an area that we need the improvement. As you can see, that there is more than 50% of the facilities that do not have the waste storage area. Next slide, please. Next slide, please.
It's moved. Can you see the next one? It's on waste storage.
So waste, yeah. So waste collection and containers. So you can see that there are about 64% of the facilities, they have proper waste collection containers that are provided. And at this juncture, I would like to also acknowledge the support that is provided by WHO and also from UNICEF in the area for the provisions of the needs for the healthcare facilities. The priority action for Fiji, we need to strengthen implementation of our national WASH and IPC standards. We need to improve waste segregation and secure storage systems. We need to expand our training for environmental health officers and also the facility staffs. As I've mentioned that we do training every year, but we have staff turnover and also the attrition rate is high. So we need to continue the training every year. Strengthen routine monitoring of using wash feed, improve access to supplies, equipment, and also maintenance support, increase investment in resilient healthcare waste treatment system to finalize and also personalize the national SOPs and also for the WASH and also the healthcare waste management in healthcare facilities, and align our facility improvement with WHO and also UNICEF WASH minimum standards. So this is the recent progress and the next steps. So you can see that following the WASH fit assessment, there was a national healthcare waste training of trainers workshop that was done. And also field assessments were conducted to strengthen the facility level capacity on safe and environmentally sound healthcare waste management. The training of trainers.
I think we are not on the same slides. Which slide are you on? Because you're seeing a graph here.
Are we on slide 39?
Okay, good. Thanks.
Are we on slide 39?
Yep. Go ahead.
So the training of trainers build the capacity of the divisional and subdivisional health officers, our IPCO officers, the clinical governance officers, and also the facility staff on healthcare waste principle and also on the practices. Supported them in conducting the healthcare waste management assessment and strengthening routine monitoring and improving planning. Field visit, I'd like to also acknowledge the support from WHO in doing field visit across the division and help identify the operational policy and infrastructure and workforce gaps across the full chain. Fiji is also developing a national standard operating procedure for WASH in healthcare facilities, which will include a dedicated section on healthcare waste management, and also the recent launch of the WHO and UNICEF WASH minimum standards for healthcare facilities, which further supports the national efforts to strengthen safe, climate resilient, and also the quality of WASH and healthcare services. So the next slide number 40, conclusion. WASH-FIT provided Fiji with a practical framework for improving health care waste management. The assessment identified both progress and critical gaps.
Sorry, Luke, I'm trying to find this is the one, right?
Yes, the slide 40.
Yes.
Yeah, so the assessment identified both progress that has been done in the healthcare waste management space and also the critical gaps that needs to be identified, that needs to be addressed. The safe water waste management is essential for quality healthcare and also to prevent infection. Ongoing monitoring and investment in capacity building are needed to sustain the improvement, and the strong collaboration across all levels of the health system is critical. I think that is the last slide. Thank you very much for this opportunity.
Thanks so much, Luke, for a very interesting and detailed presentation and a lot to learn from Fiji. You've done a great set of guidelines. You've done very depth assessments. You've demonstrated the use of WASH-FIT and set a great example for others. So I think in interest of time, again, I'll come back to Arabelle. we are straight away going to question and answers now, Arabella.
Yeah, that's correct.
So we have a question in Q&A section. Let me see, there's one question here. I'm reading out for you. I don't think that's relevant to, wait, it's a long one. I'll read out from the other question bank. There were some useful questions already, important ones. Some are already answered during the presentations. One is on how to make WASH tangible and impactful in margin of society, which means how to make it sustainable project. Should I direct this to Utay or Utay? Yeah, do you want to come in?
Yeah, I think Maggie is the one who can better answer this question. Okay.
Maggie?
Yeah, please.
Yeah, no, just a few quick reactions, and would actually love to hear from Luke as well in the Fiji example. But I think a few things. One is doing those initial assessments and presenting it back to the facility administrators, to the local community leaders, to the regional health authorities, we found has been really impactful because it reveals issues, it reveals things that the facility wasn't aware of, you know, especially on waste, around like the lack of bins or segregation. You know, we saw from those slides just now, and a question I have for Luke is, you know, we see huge disparity, right, between some facilities seem to be doing okay on segregating and others are not, right? So why is that? So I think one is like really understanding the situation, and that comes by doing the assessments and sharing the data. I think the second is engaging the facility staff and the managers in those improvement plans, right? So it's not someone coming from the outside to say you need to do X, Y, Z, but the facilities themselves figuring out, you know, what is the priority, what is actually feasible. And, you know, initially when we were doing WashFit, we were like very strongly emphasizing the risk approach. I think now it's much more balanced, right? It's like, what can you do with the resources you have? And obviously to address some of those wider risks. And just the last point to say is that, you know, it's not, you know, improving WASH isn't the end goal, right? The end goal is to improve quality care, to make sure that users, health workers, their carers, all have a safe and hygienic place to work in. So the more we can embed this work in primary healthcare efforts, Ranjit, you were talking about that at the beginning, in health planning and health monitoring, and in obviously in health financing, the more likely this issue is going to be kind of stuck and be sustainable within wider system change. Thanks.
Thanks. I'm just checking what are the opportunities of deep diving into technologies, and it's also linked to a question in when we registered about technologies available to low middle income countries. Traditionally, we have been talking about incineration as a standard technology, but we are also moving in the direction of green technologies. So where do we see future going in for waste management technologies accessible to all, sustainable by nature?
Yeah, maybe I can take that one. And again, I would like to start with minimization and recycling before talking about treatment technologies. I really want to emphasize that these should be the first steps. Look at your procurement. Look how you can minimize your waste. Is the PPE you are using really needed to be used? Is there recycling opportunities available before you think of treatment technologies? So try to reduce your hazardous waste as much as possible. However, you will produce hazardous waste. So there is no question. And there are possibilities, of course, also for smaller facilities. But first, you know, when you think of the smaller facilities like the health centers or health posts, normally in the countries, you will have a lot of these small facilities, which are scattered in the country, with a lot of small waste amounts generated, which is really kind of very costly to collect, but also it will probably be not really possible to have for each and every facility a treatment technology available. So first of all, I would really like to encourage you to have a look at your neighboring facilities. Maybe there is already a facility with a proper treatment technology which you can use. Think of reverse logistics, like I've presented before. So maybe there's a car which is coming to bring some of the medical items or pharmaceuticals which can take back the waste and transport it to a centralized hub. But if you need to go for treatment technologies, try to purchase some alternative treatment technology, which is not incineration, because incineration and these small scale of waste which you would generate will not be in accordance to the Stockholm Convention. So you will generate hazardous emissions by treating this waste. So try to have a look at alternative treatment technologies, but of course you have to have a look if you have the electricity and the water to use this as well. And now there are also some upcoming treatment technologies, smaller ones with integrated shredder, which can use one-phase electricity, because a lot of these bigger autoclaves and microwaves use three-phase electricity. And now there are some smaller units as well available, which could also be used for smaller facilities. Yeah, so that's all from me. Maybe there are some more comments.
Thanks. I actually have a couple of follow-up questions for Luke, and I'll combine them together. It's on your lessons learned during the assessment and also sustainability of your project in Fiji. Maybe we can talk about both. Luke, over to you. Luke, I'm not sure your speakers are working, so maybe I'll come back to you later again. I'll continue with Ute and
again.
Luke,
Thank you for the questions.
Yes. So if you like to share your lessons learned for during the assessment.
Can you hear me?
Yes, Luke, we can hear you.
Yeah. Thank you. So for us in Fiji, the healthcare waste management was a challenge for some time. And I think not until after COVID pandemic that we realized the importance of managing our waste. And then we had started to do the training, the development of the healthcare waste management plan, and also the assessments that has been done. And then the WashFit has improved the way the healthcare waste has been managed. We continue to do trainings to our staffs. We train them every now and then. We train all the staffs that are coming in to the facilities. We have a plan in place in all the facilities that the staffs, that outlines the roles that each staff needs to play, from the people who are generating the waste, those who are transporting the waste, those who are storing the waste, right up to people that are treating the waste. So engaging the staffs is very important. And also, I think in the first slide that Uta has presented this morning, I think the staff needs to understand the importance of why we need to manage waste, the implication it has on the health of the people that are working in the ministry, and how we try and avoid that the exposures to our staffs, to the people that are visiting the facility, to the patients that are there. So that is why I think they need to take the ownership, and then the training on the waste segregation, and also in terms of the waste handling and also the disposal. And I think that is very important. With the WashFit, we're able to identify where we are, also identify the gaps and areas that we need to improve moving forward. So that's what WashFit has done. The assessment in itself has allowed us to know our status in terms of the healthcare waste management plan and how we can do improvement plans for each facility. There are bigger things that that needs support. There are small things that can be done internally within the facilities, and in terms of the segregation, the storage, and all those kind of activities that is done to ensure that the waste is handled safely. So those are the things. And as I mentioned in the results, after the WashFit now, we are able to identify where we are, what the planning that we need to do to ensure that training is done, and also that they have the plans, and also we have the implementation on how we're going to improve our healthcare waste management system in Fiji. Thank you.
Thanks. I have 10 more minutes for question and answers. Maybe I can take one more important one. Let's talk about stakeholders of waste management. Who are the stakeholders in this? When we can we talk on that? We have WASH, we have health, we have primary healthcare. Who takes lead on what? How do we? I mean, it's a contextual. Different countries have different way forward. But can we talk on that, Maggie? Your views.
Yeah, great question, Ranjit. I'd love to hear your views as well. I think it depends on the entry point. I mean, certainly when we're looking at just healthcare waste, we see that the vaccine community is obviously highly engaged. We see the child maternal health community linked to some of the waste. Also on the pandemic preparedness side, again, there's a strong emphasis there to want to be good stewards and recognizing that they're generating a particular amount of waste, and that waste needs to be safely treated. In terms of, waste is one that often falls through the crack. I think with water, it's usually much more clear. Most countries have a Ministry of Water, and, obviously they're kind of those municipal services are linked directly to the Ministry of Health. But normally for any of these WASH issues, there should and ought to be a focal point within the Ministry of Health, because it's not just about the services, but it's about making sure the services are of high quality and protect the health of humans and the environment.
Yeah, thanks a lot. And I'd also like to add, you're absolutely right. It's the entry point that matters. I mean, it depends. For us, immunization has been the strong entry point. I've also WASH in UNICEF. And we have been trying to advocate for, just to conclude that we have been trying to advocate that waste management, and I say again and again in every meeting that it's not one domain's problem. There's no, somebody will have to take the lead. It's not individual silos matter. We need to step above that, and somebody need to take that lead. And I'm happy that WHO, Maggie, you're taking lead through WashFit and talk about this important subject. We do the same from immunization side, WASH side. We do bring this matter up and try to resolve. Also, I'm looking at comment from Prakash, long one, but he's also pointing out towards how do we do the transition to green technologies. It's not an easy subject. It's not an easy task. We have gone through years of mismanaging the waste, and whatever the way we can handling incineration and immunization has brought up safety boxes, and then what we do with safety boxes is another story. Where do we go? How do we transit to green technologies, and also in this given space of reduced budgets? It's an important question, Prakash. Thanks for bringing out. We have to have stepping stones. We need to take baby steps here, and I think what Ute also brought up, to look at your budgets, to look at improve the programming here, have a national lens on the problem. Somebody sitting at the national level, we need to have a national level committee where members from health, from finance, from environment, from climate, they all need to be in that meeting, in that committee, and take a plan forward. And our approach in UNICEF has been, and also with WHO, with Maggie colleagues, is really to push on the roadmaps for waste management. To look at a roadmap and say, where do we go from point A to point B, in how much of time? What do we do in short term? What do we do in long term? And my solution to you, Prakash, is to look at some introductions in short run and say, can you sustain, can you demonstrate a positive trend towards managing it green way? And cost-wise, there's been clear demonstration that if you compare apple to apple, you compare cost of burning the waste versus cost of treating it through green waste, it's cheaper. It's not cheaper to do that way. And there's also, forget about, we need to bring the aspect of climate, carbon emissions, the load, load we add to the climate with the non-green technologies. So the first step is really look at how do we demonstrate using the green technology in a small scale and then have a long-term plan of scaling it up? That, and then I have a few more questions in the list here with me. I thought they were very useful and not addressed. How about climate resilience integration? Want to take that? Integration of climate resilience. And I think, and I see that you are actually touching upon in your coming series, right? I see that there are some sessions on climate resilience. Maggie, you want to take that? Yes.
I'm not going to take it, but I see we have one of our climate colleagues who's also a healthcare waste expert on the call, Mega. Mega, I'm wondering if you could just hop in and address that question, especially in light of some of the recent discussions last week at the World Health Assembly.
Hi, Maggie. Can you hear me? I'm on my phone, so I'm not sure if you could hear me well.
Yes.
Great. No, thanks and congratulations on this webinar. I think it's you covered a lot of ground, and yes, the link with climate resilience is really, really critical and important, and partly also covered by your comments and Utej's comments. When we talk about the treatment technologies that we're looking at, the waste reduction options that are there, I'm kind of seeing that all of that is really critical when we think about low carbon and sustainable environmental facilities. And yes, climate resilience is all about a connection to waste management. Yes, we're looking at more greener technologies, but also connecting it to your WashFit efforts would be important, Maggie. In the series that we did in Attach, I think we covered a lot of ground in terms of how we could address this jointly within the climate resilient and low carbon healthcare facilities. And just that maybe, you've already addressed the guidance that we have, but also that was covered by our Fiji colleague, is we have a toolkit again for climate resilient and low carbon environmentally sustainable healthcare facilities. So maybe that's something we could also share with the audience, and maybe in the package that you have, Maggie. So I'm not sure if I was able to answer it, but yeah.
Sure. No, thanks. Thanks, Mega. We certainly can share that. There was a slide too with all the links that got hidden, but we can make sure it's exposed, but I can put it in the chat as well.
Thanks so much. We have last 5 minutes, and maybe I invite David to come in and give us a sneak peek on what's coming next.
Yes, thanks very much, Ranjit, and wonderful moderation. And wow, what terrific speakers and information being shared. I think I'm taking control here. Yes, we'll advance. Great. So hello, everybody. My name is Dave Truba. I'm part of the WHO headquarters team. And what I'm going to speak about today is something that we hope is an asset to our resource, to all of you and many of your colleagues, that will, contribute to incremental improvements in healthcare waste management everywhere. So we're going to give a little bit of a preview of a course. It's called Advanced Healthcare Waste Management, including considerations for treatment, mercury, and pharmaceutical waste. But it's really a foundational course, more so than advanced, I would say, because if you don't know a lot about healthcare waste management, this is a very good starter course. And it's basically going to be launched on the WHO Academy platform. We hope within the next 2 weeks. It's a self-paced learning course. I'll get to the modules in a moment. Basically, you should be able to finish it in 2 hours or less. And it's basically designed to help health facility staff, managers, healthcare waste workers, planners, environmental health professionals, even policymakers and others strengthen waste management. And it's especially relevant for the WashFit audience, because as Uta mentioned, there is a module in our WashFit course on the WHO Academy on waste management, but this is really a deeper dive. So let me advance. And as you can see, there are really 6 modules that this course is structured around. It begins with the overall system, what waste is generated, how it should be classified, and how the end-to-end pathway should work. then moves on into treatment options, looking at infectious and sharps waste, including non-burn technologies and high temperature incineration with proper controls, exactly everything that you've heard about today. Module 3 looks a little bit more on planning and procurement, and as Ute mentioned, procurement to reduce waste streams is critical in the entire process. A really exciting part of this is Module 4, which is essentially an interactive calculation tool for waste generation and treatment capacity. We'll speak briefly more about that in a second. And then the last 2 modules are deep dives into mercury and pharmaceutical wastes, which of course require additional safeguards. So one of the strengths of the course that we feel is that it moves beyond general awareness and actually helpful for practical decision making. This module 4, for example, the calculation tool, it's an interactive tool. It can help facilities estimate infectious and sharps waste generation. It can help to align treatment capacity with actual facility needs. It's good for routine planning, but also for outbreaks, emergencies, or service expansion when waste volumes increase, for example. So it's exactly the kind of planning tool, practical one, we feel that supports WashFit implementation cycles. So the course is designed for the folks that I mentioned earlier, particularly health facility staff and managers, but it's not just really a course that could be completed individually, although it can be used really as a practical complement for WashFit teams, especially when developing improvement plans, training staff, as was mentioned by our colleague from Fiji, reviewing waste flows and so on. And it also has, we hope, a couple of interesting elements to keep it from being boring. We don't think it's boring. We think it's actually quite nice because it does have the calculation tool and a few interactive video elements. What I'm going to show briefly is just about a 1-minute segment of a video, which will be made available separately on a new SOP for mercury spillage that WHO released earlier this year. So I'll leave it at that as just a little bit of a preview. As I said, in a week or two, you'll be able to watch it entirely. And that particular training video goes on through the steps that should be taken if there is a small mercury spill in a facility. We hope that you like it. And again, it will be made available outside of the course as well. So just my last slide is to say that this course is part of a sort of a growing WASH learning ecosystem from WHO, with many of the courses developed, of course, in concert like this one with UNICEF. A great thanks to Ranjit, to Maggie, and to Ute for their leadership on this course. As you can see, some of the other courses that we have online are complementary, having to do with environmental cleaning or waste management, IPC, and of course, for other colleagues, we of course have plans on courses on WSPs, monitoring of safely managed on-site sanitation, GEDC in healthcare facilities. So we hope that this course that will be launched and these courses will be useful to you either as an individual or for sharing with government colleagues who run national training programs, with universities, with professional organizations or societies in the country that may be doing capacity building in water, sanitation, and hygiene and health. And we hope that you will absolutely sign up. Once the course is available, we'll send an email to you directly, and we look forward to you taking it. Thanks very much, Ranjit.
Thanks, David. And yeah, we are just about time. It's 1 hour into our sessions, and I'd like to thank everyone, Maggie, Ute, David, Luke, for your contributions, and all the participants for being here. And please do come for the next round of WashFit session, which will keep you updated. Thanks a lot, everyone.